When I was about 19, I started having some gut problems. At first, I didn't really think much of it. You know, there can be kind of this culture, especially among young men. There's almost like a glorification of pain, you know, especially stomach pain. Oh man, my stomach hurts so much. I ate so much last night. Oh man, I drank so much and my stomach hurts. You know, it was kind of easy to dismiss, but after a while, I really had to start paying attention. I was having lots of different symptoms, erratic symptoms that were really coming and going, a lot of gas and stabbing pain. You know, I started noticing that it was impacting my mental health too, my energy, my focus. And so I started seeking help. I went to a nutritionist, I went to doctors. There were a lot of doctors that, you know, when they couldn't find anything wrong by the definitions that they are used to, that they kind of put it under the label of, well, it's stress or it's just in your head. But I really trusted my gut, so to speak, and, you know, knew that something deeper was wrong. What I ultimately found out is that I have celiac disease. Celiac disease is when your immune system thinks that a protein that's found in wheat called gluten is a bad thing. And it attacks that protein and also attacks your own intestines. And the only real treatment for it is to strictly avoid gluten, that protein, and any contamination of food with that protein. I'm really proud that I went to the doctor, and I'm proud that I got answers, that I got second answers. But I think that I didn't ask the hard questions of doctors when I should have. I didn't really stand up for myself. I took the answers that they had for granted, and I either went with the answer or I looked somewhere else, rather than asking if there's anything more that we could do which might have helped us catch this a lot sooner. And so we have to be our own advocates, you know? It's great to go to the doctor, it's important to go to the doctor, and once you're there, like, we have to stand up for ourselves and make sure that things are being looked into as thoroughly as they need to be. Nutritionists can help, nurses can help, and getting multiple opinions from multiple different people with different backgrounds and different training is a really powerful way to make sure that you're actually getting the most robust answers you possibly can for your own health. I wish that I had known that having gut problems is something that happens to people, that it's normal in that it happens to a lot of people, but it's also not normal in that it's something that you should really get checked out. And I think we need more spaces and more ways that men can talk openly about their health challenges and their health behaviors that they do to support themselves. I would say that the benefits to my overall health, my mental well-being, my energy levels, my ability to do the things that I want to do, all of that is absolutely worth any struggle 1,000 times over. Seeking answers about your health, being proactive about your health, doing something about your health, whatever that looks like, and it looks different for everybody, that's a sign of strength, not weakness.